If you've got an annoying snapping sensation in your hip when you lift or extend your leg or perform activities like running or going up and down stairs, then this is the video for you, because we're about to go over 3 quick and easy strategies to get rid of snapping hip syndrome. Let's get into this. Like we talked about in part 1, the most commonly implicated structure with an internal snapping hip syndrome is the iliopsoas muscle. Now, this is a big, strong muscle. It runs from the lower portion of the torso along the inner bowl of the pelvis, and it attaches along that inside edge of your femur or upper leg bone. It performs this motion known as hip flexion. Now, you'll often see this type of snapping hip syndrome in people who sit a lot. In my clinic, I usually find it among weekend warrior types who are sitting in an office all week long, and then on weekends they go push themselves really, really hard. Oftentimes these people will experience symptoms when they're involved in hip flexion activities like going up and down stairs, or particularly with running. This type of snapping hip syndrome is unique in that it's often accompanied by pain right in the groin near where that iliopsoas muscle attaches. Now that you know what you're dealing with here, let's get into the strategies. Strategy number 1 is to use a percussion instrument or a massage gun to help soften up the iliopsoas. Like I said, this type of snapping hip syndrome is most commonly seen in people who sit a lot. And when you spend that much time sitting, one of the things that can happen is that little bits of scar tissue will begin being deposited inside of your hip flexor muscles. And this actually contributes to a physical shortening of that tissue, which makes it progressively more difficult to move into hip extension to open that hip up. And so spending just a little bit of time with a massage gun can really help you to get the extension motion back into the hips by helping to break up some of those adhesions. And so I like to use a broad-based attachment there, a wider attachment to help me cover more surface area, because the iliopsoas is quite large in some locations, especially here around the pelvis. And then you're going to need a mid-level setting on your device so that you can have enough power to get down through some of the organ tissue that the psoas muscle sits behind. And then where you're going to be aiming, I'm going to demonstrate this from a standing position because it'll be much easier for you to see. And then I'll show you the position that you should actually be in when performing this, but you'll be able to visualize it better here. So find your belly button, come up about 2 inches from there, and then slide out to the side right along the edge of where your rectus abdominis muscle ends. So like where the six-pack muscle, you'll feel like it drops off into like a little ditch there, and that's your spot. So it's about, depending on how wide your torso is, call it 2 to 4 inches off the side of where your belly button is, and then you're just going to go in right next to that. Now, you don't need to push super hard here. If you've got a quality device, the massage gun should be doing the work for you. This should actually feel really good, and then you're just going to run from top down. And when you get down to your pelvis, you're going to feel 2 bony bumps right here in the front, sticking out like that. Those, right about where your pants sit, actually, that's known as the anterior superior iliac spine, or the ASIS for short. Now, you're going to want to make sure to steer clear on the inside of that. We're not using this device on top of bone. So go right inside to the ASIS, and as you do, angle your massage gun outward a little bit, because that iliopsoas actually runs along the bowl of your pelvis. So you want to be kind of pointing outward so that you're hitting that bowl, and it'll help you to skip hitting that bone, which is going to make it more comfortable. And then you'll just run down along the inside edge of your pelvis. You're then going to do the exact same thing on the other side. Now let me show you what position you should be in to get the best result. The best position for you to be in by far when using a massage gun to release your psoas is lying flat on your back on a firm surface. This is going to allow all your posture and support muscles to relax, which means that the percussion from your device is going to have a much easier time getting way down to the psoas. So with the massage gun in hand, go flat down on your back. And then what you're going to do is extend one leg straight out in front of you. The opposite leg should be bent to about 45 degrees. This is the side of the psoas that we're going to be working on, the bent knee side. Then just find your belly button, 2 inches up, 2 to 3 inches out to the side, right where the edge of your rectus abdominis muscle is. Allow the weight of the massage gun to create the downward pressure. You don't need to be pushing into your guts. That's not helpful. And then just slowly work from there down towards your pelvis. And when you hit that bony bump, that ASIS that we talked about, come to the inside of it, don't go straight over it, and angle the gun slightly outward. That angle will actually be determined by how wide your pelvis is. If you've got a narrow pelvis, it's a very slight outward angle. If you've got a wider pelvis, you can angle outward more like that. But just work your way from top to bottom. You can spend 30 seconds or a minute in the lower location and in the upper location, and then what you would do is bend the opposite knee to 45, straighten this side, move over there, and do the exact same thing on that side. Strategy number 2 is a slow stretch technique designed to elongate and open up the muscles on the front of the thigh. And one other muscle group besides the psoas that's commonly involved in these internal snapping hip syndrome problems is the quadriceps muscle group, that big muscle group on the front of the thigh, especially the rectus femoris, because that muscle in particular crosses the knee and the hip, and it's heavily involved in hip flexion. And so what we want to do is open that muscle group completely up and give every opportunity to restore normal extension motion or backward motion to the hip. Now, to perform this stretch, your body position is what matters most. So the setup for the stretch is actually quite easy. You say I'm stretching my right quadriceps, I'm just going to bend my right knee up behind me, and then I'm going to reach back with my opposite hand, in this case my left hand, and I'll grab the top of my foot and draw my heel to my buttock. That's the easy part. But here is the more challenging part. I'll demonstrate as if I'm stretching my left quad here. So what I would do is bend that left knee towards my butt, reach back and grab it. But the mistake that most people make when performing this stretch is that they arch their back, which basically takes all of the stretch off of the hip flexor. So what I want to have you do instead is, with that knee bent towards your rear end, tighten your butt muscles so that your butt actually tucks underneath you, and then engage your abdominal muscles to keep your pelvis neutral. Now, holding that muscular contraction, you'll draw your heel to your buttock, and that's going to give you a nice stretch right along the hip flexor portion of the quadriceps. And of course, if you need, during this stretch, you can reach out and have the wall for balance and support. And if that helps you to focus on squeezing your butt muscles and keeping that pelvis neutral as you perform this stretch, by all means, have your hand on the wall when you're doing it. But you'll hold the stretch for 60 to 90 seconds on one side, switch over to the opposite side, and repeat. Strategy number 3 is all about restoring extension or backward motion into those tight hips. And for this, we're going to be using one of my favorite all-time exercises, the step up. The only thing that you're going to need for this is a sturdy surface to step up onto. You can use a bench or a chest or a sturdy chair. Now, if you're going to use a chair, it's best if you can back it up against a wall so that it doesn't slide out on you while you're performing the exercise. Once you've got your surface, just stand facing your chair, and then I like to have people start out pretty close to it, about 2 or 2.5 feet away, and then you're going to brace your abdomen just like we did for strategy number 2. Keep a nice upright torso. Step up on the platform. Make sure that your entire foot is on the platform. I don't want to see any heels hanging off the back of the chest or the chair. Whole foot's up there, and then you're just going to lean forward over that foot, keeping the back knee as straight as you possibly can. It's fine if your heel comes up off the floor. Hang out for a second, return to starting position. Whole foot on the platform, reaching forward, keeping the torso upright. Notice how at the bottom of this motion, my leg bone is positioned backward in relation to my torso. That is hip extension. That's what you're looking at right there. Now, one common mistake that I see with this motion all the time is that people will come in and lean forward as they do that. Now, in that position, you've completely lost hip extension because my leg bone is no longer positioned behind my torso. I've taken the hip extension out of the motion. So make sure that you brace the abdomen, stay nice and tall, vertical through the torso and allow the leg bone to travel behind you, and that's hip extension. So 15 to 20 repetitions, switch over onto the other side, and repeat. One final note on step-ups. Like I said, when you're first starting out, it's best if you are standing closer to the surface that you're stepping up onto, like 2 or 2.5 feet away. One other thing that you can do to make yourself more comfortable when first starting out is to have one hand on the wall as you're going through the motion. Not only can this help you with stability and balance, but it can actually take a little bit of weight or strain off of your hips and knees. As you get better at this movement and stronger, you can take your hand off of the wall, and you can even move yourself a little bit further away, which is going to create even more hip extension mobility. Thanks so much for watching. I really hope that you enjoyed this video and that you'll put the information to good use. If you want to find out more about the massage guns that I recommend, check the links in the description down below. But before you head over there, make sure to click that thumbs up button and subscribe to the channel so that you're updated when the next video comes out. That's all for now. See you next time.